today we're going to review how to get started with Western Health Advantage if you have not had the opportunity, and how to access your acupuncture, chiropractic, and eyewear benefits through either your Mywall account, our website, or the vendors' websites themselves. My name is Denise Gruden. I'm the Medicare Sales Executive with Western Health Advantage, and I will be taking you through today's meeting. So first, if you haven't already done so, you'll want to create your Mywall account. This will give you online access, and it gives you quick access to view your benefits or look up claims. You can find a provider or a specialist, or do cost analysis on a procedure that is scheduled an elective surgery or procedure that's coming up. You can also check the formulary for medications you're taking or have been prescribed to make sure that they're on the formulary, what your co-payments will be, or the steps to add them to your formulary if they're not already on there. This is basically your gateway to obtaining the information that you need, including links to your alternative benefits, such as your chiropractic and eyewear, which we'll be discussing today, and many, many more. So today, as I said, we're reviewing your chiropractic, your acupuncture, and your eyewear coverage that are included in your MyCare plans. This should only take, as I said, about 15 or 20 minutes. It's pretty straightforward. So your chiropractic and acupuncture benefits are administered through Landmark Healthcare. These are considered alternative benefits, and it's an alternative for some folks as opposed to traditional medicine. So when you seek chiropractic or acupuncture care, you'll choose your provider from the Landmark Healthcare list of providers, and we'll show you how to get there. Alternative medicine can help alleviate many conditions that affect your back, your neck, your joints. It can even help give you relief from headaches, asthma, or allergies. I know this firsthand, and for me, it is my first choice versus running to the doctor, but that's my choice. It does help me with a few of these things we've listed here. Now, you do not need a referral from your primary care doctor to seek care through chiropractic or acupuncture services. You have direct access to Landmark Health providers through the Landmark Health Plan website, or as I said, through your MyCare account. The copay for either the chiro or the acupuncture is $20, and this is with both the MyCare and the MyCare Plus plans. For those of you who might be joining us that are on group plans, the copay and visits may vary, so please refer to your evidence of coverage for specific plan information. Now, you have up to 10 combined visits per year on the MyCare plan. That means you could do 5 chiro, 5 acupuncture, or 1 chiro, and 9 acupuncture visits, however you want to mix it up. You have up to 10 combined visits per year with the MyCare plan, and up to 20 combined visits per year with the MyCare Plus plan. So it's a pretty generous benefit and pretty reasonable copay. Right here, we've listed the Landmark Health Plan, phone number, and website. In the welcome brochure and kit that you should have received by now, this is included, as well as on your member portal and the website. So again, I put the plug in here for the Mywall account. It is available to all of our members, simple to register for. You just go to westernhealth.com and go to the login section. And if you haven't created a access to your to your member portal, you'll go ahead and register. So once you reach the Landmark landing page, this is an example of what you'll see. When you log in here, you'll want to click Find a Provider or go straight to the members. This will take you there as well. And this will take you to this page where you can search for a provider, but you'll want to first choose the plan. So it would be Western Health Advantage. And here, just go ahead and click on that and it will bring you to the next page where you can search for providers. You can search for a plan by name of facility, doctor, address. You can choose the radius from your home, like 5 or 10 miles, and it'll give you a whole list of providers that are available to you. In addition to finding a provider, you can also view your Cairo and acupuncture benefits. So whatever plan you're on, you'll be able to view those benefits for both of these services. You can do this either right here at the website. Again, you have 2 resources to finding benefits, either through the Mywall account or the Landmark Health Plan website. Of course, you can always call member services. The phone number is on the back of your member ID card, and we can help you navigate through either site or answer any of your questions. Our team is wonderful at the Member Services Department, and they're here 24/7 to help you through whatever questions or needs you have. So I'm going to pause for a moment just in case we have questions on the Cairo or acupuncture before we get into your eyewear benefit. Oh, not yet. Doesn't seem like we do. Okay, well, let's jump right in. So for your eyewear benefit, you're eligible for your annual eye exam through Western Health Advantage through our participating optometrist or ophthalmologist. So your eye exam is covered through the medical side of your membership with Western Health Advantage. And then if you receive a prescription for eyewear, you'll take that prescription to any MES vision provider to fill your glasses, frames, or contact lens. In case you don't know, MES Vision stands for Medical Eye Services. So again, every year you'll have your eye exam through your medical group, such as Mercy Hill, North Bay. And if you receive a prescription, you'll take that to your MES provider. I know it's reiterating that, but I really want you to understand. A lot of people who might be used to having MES as a full vision plan on their group benefits or elsewhere, they try to sign up or book an appointment with an MES provider for their eye exam. That's not how this plan works. So there is no need for a primary care referral, much like the Cairo or the acupuncture. You simply look up an optometrist, ophthalmologist, or other eye provider through your medical group on the provider search tool on the WHA website or through your Mywall portal. Find a provider and you can just make the appointment direct without a referral. So your eyewear allowance for the MyCare plan is $100. For the MyCare Plus plan, you have a $200 allowance. Again, with group plans, this could vary by group plan, so check your evidence of coverage for your copays and specific benefits. So every 24 months is when you can use your allowance. There is one exception. If you have a change in your vision, such as a shift in the axis or astigmatism of 15 degrees or more, you will be eligible for a new pair of contact lens or glasses at the 12-month mark. However, you want to take your current glass frames with you and your prescription, so take your existing glasses to any MES provider to receive an updated lens. That's at the 12-month mark if you have this change. After that, at the 24-month mark, If you choose to change your frames, kind of upgrade or get the newest fashion, whatever you choose, you can use your credit at the 24 months again to replace those frames. So where can you find an MES provider? Typically, your ophthalmologist or optometrist will have material dispensaries at their offices, so you can have your prescription filled there. Or if you like, you can choose one of the major chains, such as Lens Crafters, Stanton Optical, Target, Walmart, or Costco. And I'm not knocking the optometrists and ophthalmologists, but some folks prefer to use, say, Costco or Walmart because they basically get more bang for their buck, so to speak, with the frames and the selections. But it's your choice. And here's the phone number for an MES provider, or again, the website, www.mesvision.com. This information is printed in your welcome brochure and in your materials as your welcome kit, and also on our website and your WHA portal. When you log into MES Vision, you'll see this really nice landing page. You'll go ahead and click on Find a Provider right here at the top, and then you'll be brought to the next page where you can search. Here you can do a couple things. You can search for a provider by name, or if you're looking for any Walmart, Stanton Eye Care, Target, Costco, whatever is closest to you, you can search by location. You just, again, choose the radius, 5, 10, 15 miles from your location. You'll type in your address, and it'll find the closest, give you a map with all the locations that are within that range. So I know that was short, and like I said, almost 15 minutes, but that is our presentation on your alternative benefits. We'd be happy to go into more detail with you if you'd like. So if you have any questions, please feel free to type them in the chat box here. Reach out to us at 888-563-2250, or go ahead and just call the Medicare sales team. We can go over some of this with you as well. Okay. Well, so far I'm not seeing any questions. Elissa, do you see anybody?
Nope, I'm not seeing any questions.
Okay. Well, I hope this was useful. If I can kind of have a shout out if it helped or not, that would be great. Thanks to that participant. Oh, thank you. Okay, so here we go. Are there any conditions not covered for acupuncture and chiro appointments? Conditions, well, that's not a question I can answer direct, but there is exclusions in the evidence of coverage. So I would refer you back to your evidence of coverage for covered services and excluded services. If you still don't see it or don't get your answer, call our member services and they'll switch you over to eligibility. I hope that helped. Okay, great. Well, while we're still waiting to see if anybody comes up with a question here, I'd like to remind you that we do have some more live webinars going on. This Thursday, you probably don't want to miss. The presentation will be given by Mom's Meals. This is a benefit that's new this year to our members, and it provides, it's a meal program. If for some reason you have a stay in the hospital or rehabilitation center, and once you're released, you have access to up to 56 meals per year when you're released from the hospital. So, or actually, I think it's 56 meals per, I'm not sure, I think it's week or month. But go ahead and register for that webinar and learn about your mom's meals benefits. And then after that, we will have a recap. So there's a couple more coming up. If there's one that you missed, such as the dental or the true hearing, those webinars will be posted on our website once we conclude with the live series. So look for it maybe next month, and you can go back and revisit those webinars and hear what you missed. Okay, well, I think that will do it for today's webinar, and I appreciate you attending. Please reach out with any questions, and thank you so much for choosing Western Health Advantage. Have a good day.